Welcome. Today I am going to discuss about identification and medicinal treatments of cough. Coughing is a common reflex that helps to clear your airway of irritant, mucus or foreign particles. There are several reasons why someone might cough. First one is infections. Respiratory infections like common cold, flu, or pneumonia can cause coughing as the body tries to clear mucus from lungs and throat. Second one, allergies. Allergens such as pollen, dust, or pet dander can irritate the airway and trigger cough. Next one, asthma. This chronic condition involves inflammation and narrowing of airways, often lead to coughing, wheezing, and shortness of breath. Next one, GERD, gastroesophageal reflux disease. Acid reflux can irritate the throat and lead to coughing, especially when laying down. Next one, P&D, postnasal drip. Postnasal drip can be a real nuisance. It happens when mucus from your nasal passages drip down the back of your throat, often leading to the coughing or throat irritation. Next one, medications. Certain medications, particularly ACE inhibitors, angiotensin converting enzyme inhibitors, used for high blood pressure, can cause persistent cough as a side effect. Example, enalapril, lisinopril, and ramipril. Next one, identification of cough. Identifying the type, duration, and cause of cough important for appropriate treatments. First one, type of cough. First one is dry cough or non-productive cough, often associated with irritants, allergies, or viral infections without mucus or phlegm. Next one, productive cough. It produces mucus or sputum, which can indicate a respiratory infection like pneumonia, upper respiratory tract infections, chronic conditions like bronchitis, COPD, lung abscesses, and bronchiectasis. It is widen and thickening of bronchi. Next one, duration of cough. Acute cough. It lasts less than 3 weeks, often caused by infection like common cold or flu. Upper respiratory tract infection is more common than lower respiratory tract infection. Most common viral infections than bacterial infections, and non-infectious cough like acute exacerbation of chronic cough. Next one is subacute cough. It lasts more than 3 to 8 weeks. Most common cause post-infectious deceive syndrome. It is due to upper regulation of cough receptors during the infection. In India, if cough persists more than 2 weeks, check for tuberculosis. Third one is chronic cough. It lasts more than 8 weeks. Take a chest X-ray to check for pneumonia or other lung conditions. If abnormal X-ray, it may indicate chronic pneumonitis, lung cancer, non-cancerous lung tumors, tuberculosis, pleural diseases, pneumoconiosis, ILDS and COPD. ILDS means interstitial lung disease, chronic obstructive pulmonary disease. If normal X-ray, it may indicate asthma if patients have shortness of breath and wheezing, or cough variant asthma, it most commonly in children. Second most common cause is upper airway cough syndrome, mostly due to the post-nasal drip in night. Third cause, non-asthmatic eosinophilic bronchitis. This is the patient don't have bronchoconstriction, so no wheezing, only inflammation. Most commonly, steroid inhalers are used for the treatments. Fourth cause may be gastroesophageal reflux disease, GERD. It is due to the acid reflux from the stomach. Proton pump inhibitors used for the treatments. Next one is associated symptoms. Associated symptoms is very important for the identification of cough. First one, cough with fever. Often accompanies infection like common cold, sinusitis, flu, pneumonia, bronchitis, COVID-19, whooping cough. Next one, shortness of breath. Cough accompanied by shortness of breath can be caused by various conditions like asthma, chronic obstructive pulmonary disease, COPD, bronchitis, pneumonia, pulmonary embolism. Next one, allergies. Cough that occurs after exposure to allergens or irritants such as smoke or pollutions, or exposure to different environments. Medical history. Previous conditions like asthma, COPD, or chronic sinusitis can be relevant. Physical examination. Healthcare provider will listen to your lungs and check for sign of infection, congestion, or other issues. Next one, identification of cough by sputum. Sputum can provide valuable clues about respiratory conditions. Sputum or phlegm is the mucus that comes from the lungs and it is expelled through the coughing. Identifying the characteristic of sputum can help in diagnosis of various respiratory issues. Next one, color of sputum. White. Mucoid, it's a nature of mucus, no need of antibiotic. Second one, yellow or green, typically suggest bacterial infection or chronic bronchitis. The color change of mucus is often due to the presence of neutrophils and the enzyme myeloperoxidase. Bluish green sputum may be Pseudomonas. Red currant jelly sputum may be Klebsiella pneumonia. Red or pink colored sputum could indicate the presence of blood, which might be due to conditions such as tuberculosis, lung cancer, or severe infections. Black colored sputum, it indicates atmospheric pollution or coal workers. Brown phlegm or rusty can be associated with old blood, bacterial infection like pneumonia, cystic fibrosis, or smoker. Next one, Consistency. Consistency is very important for the identification of disease. Thin and watery, common in viral infections or allergies. Thick and sticky, might indicate chronic bronchitis or respiratory infection with more mucus production. Next one, treatments of cough. Diagnosis of disease. Diagnosis of disease is very important before the treatment. Cough with running nose may be rhinitis. Cough with running nose and fever may be rhinitis or viral infection. Cough with change of voice may be laryngitis. Cough with tingling sensation on back of throat, it may be P&D. P&D means post-nasal drip. Next one, cough with wheeze, it may be bronchitis or asthma. Cough with fever, with chills or shaking, shortness of breath, rapid breathing, chest pain, may be pneumonia or bronchitis. First one, treatment of rhinitis. No need of antibiotic. Use nasal decongestant and antihistamine. Nasal decongestant, Sinarest. Tab Sinarest, 1 tab 3 times a day, 3 to 4 days. It's contain levocetirizine hydrochloride, phenylephrine hydrochloride with paracetamol. Next one, Rhinostat. 1 tab 3 times a day, 3 to 4 days. It's contain paracetamol, phenylephrine hydrochloride, caffeine and diphenhydramine hydrochloride. Next tab is Vicuril. 1 tab 3 times a day, 3 to 4 days, depend upon the disease. Next one, antihistamine. Use cetirizine or levocetirizine 1 tab at night. If you use in the morning, use half tablet because it may feel sedation. Next one, treatment of wet cough or productive cough. Expectorant. Expectorant help to loosen and clear the mucus from the airway. Guaifenesin. This is the most widely used expectorant. The aerodil syrup contain ambroxol, terbutaline sulfate and guaifenesin. Guaifenesin available over the counter in various form including syrup, tablets and extended release formulations. Common direction of guaifenesin containing syrup. Common dose for adult 10 ml 3 times a day. For children 5 ml 2 times a day. Acetylcysteine. It is used in the treatment of chronic obstructive pulmonary disease COPD and cystic fibrosis to help break down the mucus. Next one, Piriton expectorant. It contains chlorpheniramine maleate ammonium chloride. It is commonly used to relieve symptoms of allergies such as sneezing, running nose, itchy eyes and allergic cough. Common dose for adult 10 ml 3 times a day. For children 5 ml 2 times a day. If you are using syrup containing ammonium chloride, you have to use after the food. Next one, mucolytic. Mucolytic medication work by break down the chemical bond in mucus, which reduce the thickness and stickiness. This make the mucus less dense and easier to cough up. First one is bromhexin. 8 mg 3 times per day for 3 to 5 days. Second one, acocondin. It's contain ambroxol. It is also mucolytic. 2 times per day for 3 to 5 days. Combination of medicine. Sometimes combination of medicine used for the treatment of cough. Use combination of mucolytic, bronchodilator and cough expectorant. Example, Bricarex expectorant, salmucolide, Grillindes BM. Guaifenesin. It is an expectorant that helps to loosen the mucus and phlegm, make it easier to cough. Next one, dextromethorphan. It is an cough suppressant to help to reduce the coughing. Other ingredients may include antihistamine or other compounds depending upon the specific formulation and purpose. Home remedies. Honey. A spoonful can soothe the throat and reduce coughing. Avoid in children under 1 year. Steam inhalation helps to loosen mucus and soothe the airway. Saltwater gargle can reduce the throat irritation. Next one, treatments of dry cough. Dry cough, which are non-productive and don't produce mucus, can be irritating and persistent. Cough suppressants, antihistamine and corticosteroids used to treat dry cough depend upon the condition. First one is cough suppressants. Cough suppressants used in case of dry cough. Most commonly used dextromethorphan. It is a cough suppressant that helps to reduce the urge to cough. Second one is codeine. It is also used to suppress cough. Next one, benzonatate. It is a prescription medication that numbs the throat and suppresses the cough reflex. Next one, levodopa. It is a cough suppressant. It is used in the symptomatic management of dry cough. Next one, antihistamines. If dry cough is due to allergies, antihistamine might be prescribed to reduce the allergic reactions. Next one, corticosteroids. For more severe inflammation, corticosteroid may be used to reduce throat and airway inflammation. Next one, inhaled asthma drugs. Corticosteroids and bronchodilators can help with asthma-related cough. Throat lozenges and sprays. This can soothe the throat and reduce coughing by providing temporary relief. Important points. Avoid irritants. Stay away from smoke, dust and other irritants that may cause dry cough. Elevate your head while sleeping. Keeping your head elevated can reduce coughing at night by P&D, postnasal dripping. Treatments of cough, duration, absence of sputum and wheezing are very important. Common cause of dry cough are pharyngitis, laryngitis or bronchitis. Other causes of cough are atypical pneumonia, allergy, tuberculosis, eosinophilia, cancer. Main symptoms of atypical pneumonia are cough, headache, muscle ache. Macrolide antibiotic is the best treatment for atypical pneumonia. Example, azithromycin and clarithromycin. Chest X-ray is mandatory in case of cough with chest pain while breathing. Dyspnea. Dyspnea means difficulty to breathe. Next one, abnormal breath sounds. Hemoptysis. Hemoptysis is the blood content in the sputum. Loss of weight, no response to antibiotic. In this case, chest X-ray is mandatory. Don't combine the decongestant and bronchodilators. It may lead to irritability, tachycardia, and insomnia. While treating common cold, avoid drug containing phenylpropanolamine. It may precipitate cerebrovascular accident in elderly. Do not use ciprofloxacin in pharyngitis. Do not use cephalexin first generation cephalosporin for sinusitis or otitis media. Smokers need 15% more theophylline dose than normal person. Do not combine quinolone antibiotic and theophylline, as a level of theophylline increase lead to seizure. For early morning bronchospasm, night dose should be sustained release tablet. It is the best choice. Do not use codeine in undiagnosed cough because expectorant is more important to clear airway. Cough suppressants not effective unless irritations eliminated by treatments. Healthcare provider can help determine the cause of cough and recommend appropriate treatments or further investigation if necessary. Antibiotic treatments. Antibiotics are not typically used to treat cough unless the cough caused by bacterial infection. Most cough are due to the viral infections like common cold, flu, allergies, irritants, and antibiotics are ineffective against viruses. Antibiotics may be prescribed. Bacterial infections, if cough is caused by bacterial infection such as bacterial pneumonia or whooping cough, antibiotic may be necessary. Chronic conditions. In some cases, chronic conditions like chronic bronchitis or certain type of sinus infection might require antibiotic if bacterial infection is present. Important points regarding to antibiotics. Avoid self-medication. Do not use antibiotic without prescription. Misuse can lead to antibiotic resistance and other health issues. Most coughs are due to the viral infections, allergies, or irritants, and antibiotics are ineffective against viruses. Alternative treatments. For most coughs, especially those caused by viruses, over-counter remedies, cough suppressants, and home remedies may be more appropriate. First one is macrolides. Macrolides contain azithromycin, clarithromycin, erythromycin, etc., often used for respiratory infections. Next one, penicillin, amoxicillin, commonly prescribed for various bacterial infections. Tetracycline, doxycycline, sometimes used for specific bacterial infections. Azithromycin, adult, 500 mg once daily for 3 to 5 days, depend upon the disease. In case of children, 250 mg once daily for 3 to 5 days. Amoxicillin, adult, 875 mg every 12 hours or 500 mg every 8 hours for 7 to 14 days, depending upon the disease. Next one, augmentin, 375 or 625 mg 2 to 3 times per day. Augmentin contain amoxicillin and potassium clavonate. Next one, Droxyl. It's contains cefadroxyl 500 mg 3 times per day. Next one, Claribid. It is a clarithromycin 250 to 500 milligram, 1 tab, 2 times per day. Most commonly used 5 to 7 days, depend upon the disease. Next one, levoflox. It's contain levofloxacin 500 milligram, 1 tab, 1 times per day. Next one, Bactrim DS. It's contain trimethoprim and sulfamethoxazole. It's commonly used 1 tab 2 times per day. Next one, doxycycline, doxy 100. It is 1 tab 2 times per day. Commonly used 5 to 7 days. Depend upon the disease, it may vary. Thank you for watching.